how the dilated cardiomyopathy has changed, and is it needed a continuous reclassification of the disease?
The natural history of dilated cardiomyopathy in the last 30 years has dramatically improved. Now the survival at 10 years of follow-up is above than 85%. The continuous re-evaluation of the patient during follow-up is fundamental for determining this improvement, and the reclassification of the disease during follow-up is important because during the long-term follow-up of this disease we can have other diseases that can onset, such as ischemic heart disease, valvular heart disease, hypertensive heart disease, that can cause progression of the left ventricular dysfunction in the long-term follow-up.
And what is the importance of familial screening in genetic cardiomyopathy?
When we approach a patient with non-ischemic cardiomyopathy, it's fundamental familial screening, because we have to know if we have in front of familial form of cardiomyopathy, because the relatives of probants with dilated cardiomyopathy are in general discovered at earlier stages of the disease, with consequent long-term benefit in terms of outcome. And so I think that we have systematically performed familial screening in these patients.
And what is the importance of holter ECG monitoring and cardiac magnetic resonance in dilated cardiomyopathy?
Regarding holter ECG monitoring, in the last years we've learned that it's of paramount importance also in dilated cardiomyopathy other than right ventricular cardiomyopathy, because in presence of arrhythmic expressions in terms of ventricular extrasystole or non-sustained ventricular tachycardia, and in presence of familial history of sudden cardiac death, we can have increasing risk of sudden cardiac death in the long term, regardless to left ventricular dysfunction. Regarding cardiac magnetic resonance, it's no doubt that now, in my opinion, all patients with non-ischemic dilated cardiomyopathy has to undergo to cardiac magnetic resonance, because the tissue characterization, the quantification, the pattern of late gadolinium enhancement and new indexes such as strain or T1 mapping or other in the future indexes will be the most promising in the arrhythmic and whole prognostic stratification of these patients.